Well, that's a good segue. I was gonna just wanted to make people aware I'm here from School Health and would like to offer as an escape fire for primary practice people, teaming up with your school nurses in your community. And school nurses do an awful lot in the very primary care setting with students who are in the education setting and with teachers and with families. And so that, just don't forget that as you move forward.
Do we have to listen to you?
Absolutely. And I don't need this thing. I don't think I do. The negative part of this, the overwhelming, oh my God, of this to me was money meant more than common sense. Common sense. It took 16 years to prove that a healthy lifestyle get it paid through Medicare. I mean, where do we go if money overpowers common sense? You know, us little people, we can do the best we can here with the big corporations, the money, the pharmaceutical companies. They're the ones that are going to drive this change, and until we find people like the man that was from Cigna who said, I've had enough, I can't sleep at night. I think that's the only thing that's going to change us. And it is, it's overwhelming, it's very depressing when we know that this is going on and it needs to stop.
I sort of alluded to this earlier in the last group. We are going to have to change the way we deliver health care now. We're going to have to do it soon. We're going to have to do it quickly. We cannot wait for society to evolve and modify and become healthier as a society. We are in a capitalistic environment. The United States of America is heavily in the direction of freewheeling capitalism. That is, some of you might think that's great, some of you might think it's bad, it doesn't matter, it's just what it is. And we have to live within that environment. We have to live in an environment where the individual is more important than the social group, right? I mean, that's you know, we're sort of proud of that. So we don't have any choice. We got to live in our society and the way our society works. We have to figure out how to get the healthcare system to work in a capitalistic, individualistic environment. And we will. I mean, we will because, you know, I mean, we don't want to work in chaos. And that's what's going to be, and not in very long.
I'm just going to say that the good news, I remember when Dean Ornish started this fight, and people really didn't think he was out of his mind. You all didn't think he was out of his mind, did you? I mean, I think it's the acceptance it has gained is something, and he is getting it paid for, which is huge. So I'm trying to see the positive side of that. I mean, it is certainly, meditation isn't a weird word anymore, you know? I mean, it used to, trust me, years ago, meditation was, people thought you were into all kinds of weird stuff. Yoga, look, I mean, there's a yoga shop on every corner, which I love. So there is change happening, and as Dr. Baker said, it's happening sort of, I think it's almost at the grassroots level, changing despite the other stuff. So I do think there is hope.
I find optimism a little.
I'm just balanced.
A little weird.
But I'd
Go
just like to add to Anita's comment that even within our own physician champion teams, we mentioned Dr. Paras Mehta, and he's our integrated physician, but he is currently in Andrew Weil's fellowship program, and he's also a resident at CHS. Fellow. Oh, wait, that's right, he's a fellow. So we see small changes, and I have to applaud Anita for leading the charge on that, bringing it to CCPGM and our healthcare model.
I mean, there is a lot of cool stuff happening, frankly. It's just on a very small scale. We just got to expand it out.
I was really impressed with this movie, and I hope every practitioner gets to see it. But I'm very discouraged about pharmaceuticals advertising on our TV, and I think we've all known that for a long time, that seems to drive patients coming to the doctors and saying, I want to be on Lipitor, I want to be on Cymbalta. And how are we going to, because you have so much money, I mean, you have an incredible amount of money there in that system, what can we do?
I do not know how I mean, that's again, our society is very individualistically oriented, it's very money oriented. And if you just count up the number of the amount of advertising that is done by the pharmaceutical industry, if they pulled out, in other words, if we re-established laws that it was illegal to advertise prescription drugs, which was the law. I mean, we changed it. We said it was against the Constitution, and the Supreme Court tossed it. So, but if we reestablished those rules, it would cripple our TV network industry. They're that important. So it's very interesting, these dynamics that go into impacting healthcare that are the lobbying for freedom of speech, quotes, and allowing this advertising is not driven by the pharmaceutical industry nearly as much as it's driven by our entertainment industry that uses that money to live.
It's that dark matter that she talks
Yes.
about in there.
Yes.
America has become a nation of wanting quick fixes. When we go to the doctor, when the patients go to the doctor, they say, I just want to feel this will make it better. And I think it's going to take some re-education of the public and some awareness that there's other things out there besides just a pill to take. And another thing I want to say, Kathy made a good point that about the amount of money that is driving the way our healthcare system is. The lobbyists, and their influence over our politicians. And I think it's going to take Americans' voices becoming louder than the money in order for things to change.
And that's kind of that's sort of the starting with ourselves, because are we, and really that's the only place any of us can truly make changes in ourselves, and are we expecting quick fixes? And so it is sort of starting here and doing the hard work here first.
But I tell you, there's going to be a lot of rapid change in healthcare. Somebody earlier was talking about the fact that we really started going down this healthcare negative path with the initiation of the Great Society, right? In Lyndon Johnson's domain. And Medicaid came into being, Medicare came into being, a lot of other programs came into being. I might add, within 2 years of the institution of Medicare and Medicaid, physicians' salaries doubled. Okay? I mean, some really interesting stuff. It took us a long time to get here, but we can't have it be a long time to get back. So there's going to be rapid change. Rapid change, unfortunately, is imperfect, and rapid change is painful. And we're going to go through painful times.
And I think that's what I was concerned about. I see how we can impact patients, but at the same time, I can't see with the healthcare right now, with primary care physicians being not enough out there for the load of the sick that we do have in our society, and then healthcare reform is going to make more availability for patients to have care, and now those primary care physicians that are already overwhelmed and are having to make their schedules 15-minute visits, what's going to happen when they're bombarded even with more patients? So it's like yes, this is important and this is what we're doing, but when it comes to that level, how do you change that? Because I just see it from here like getting worse. You know, if 15 minutes is not enough now, what's going to happen when they have even more patients and we have even less physicians because they're so disheartened by the load and the fact that they can't be who they really want to be and have health care the way they want it to be.
We're going to have to leave the basic mindset that the person that is going to deliver care needs to be an MD or a DO. And if you go around the world, healthcare is provided by all sorts of people. The person that was doing the acupuncture doesn't have to be an MD. The person that is delivering care, much of the care in Europe, in very sophisticated countries, with sophisticated healthcare systems, nurses do a lot of the care, and at a very advanced level. And mid-level providers or advanced practitioners, PAs and nurse practitioners, we're not utilizing them nearly as much, and we can produce them much more rapidly than we can produce MDs and DOs. So we're going to have to utilize the resources available and realize that MDs are not the only people that deliver care. In fact, teams deliver care, groups deliver care, systems deliver care, and we've got to have everybody, you've heard it a million times, we have to have everybody working to the top of their license. We just have to.
Waiting list, you might be an RN with BSN, but you're on a waiting list before you can get into the MSN program to become advanced practice. So again, you need to, it's not enough educators out there to get the people trained so that we can work at the top of our license. And I know people who've applied to get into FNP school. It's not that they're not going to get in, but it may be a 1 to 2 year waiting list. Well, that's 1 to 2 years that we have allowed people to fall through the cracks because we are not practicing where we can be practicing based on waiting lists for schools. So, I mean, we need to even shift our mindset to the education for the persons that are providing the care.
And there are new PA programs that are popping up all over the state of North Carolina. Novant and CHS are constantly being bombarded with requests for training sites. And the paradigm is odd because the practitioners don't want to serve as trainers for these people because they think it interferes with their productivity, which interferes with their income. It's the old wonderful vicious cycle. But we're working on it. I mean, the number of advanced practitioners that are going to be produced is going to increase rapidly.
I wanted to mention, on the Tomorrow Vision, I see the medical care home, and I have heard so much about it, and I'm so thankful for starting to talk about it in that manner because it's more than just medical care for our patients. There's mental health and substance abuse and poverty and all these other issues that are going to affect the overall well-being of our community and future populations. And until we all